You're listening to Mr. Medicare with Harold Solomon on the True Oldies channel, 95.9 FM and 106.9 FM. Reach the team with any Medicare-related question.
To the Mr. Medicare show. It's Thursday, September 23rd. It's 7 o'clock. So, as always, the Mr. Medicare show is on the air. I want to welcome everyone to the Mr. Medicare show. I am Harold Solomon, Mr. Medicare. The Mr. Medicare show is brought to you by the Senior Health Desk, 844-607-7283. I'm joined by Matthew Munster, one of the principals at the Senior Health Desk. So, Matt, a week has gone by since our last show. What's been happening at Senior Health Desk? You guys been sitting around doing nothing?
Yeah, just about. So no, actually, we're super busy, just gearing up for the annual election period. This is the busy season for insurance agents, and also the busy season for folks on Medicare as well. So we've expanded the team a little bit. We have a new agent. Her name is Sue, who we'll be introducing here shortly. And then other than that, we've been really trying to get the word out here on just what it is that we're doing, because what I've found is that, listen, if you're listening to this on YouTube or iHeartRadio or what have you, and you've gotten a bunch of phone calls, most of those phone calls are unwanted and unwarranted, right? So what we're really trying to do is we're trying to go out and say, hey, we're here when you need us. Give us a call. However, with that being said, I'm finding that, a lot of people, and maybe it's just human nature, they wait until the 11th hour. So we're really trying to do our best to avoid that this annual election period. The last thing you want to have, want to put yourself in a position of is waiting until the first week of December, which is the last week of the annual election period, scrambling to find an insurance agent that'll help you, because we all are going to have our hands full. We want to make sure that we attend to everybody. So, first and foremost, if you're watching this on YouTube, please hit that like button, hit subscribe, share on your Facebook page if you have friends, family members, neighbors that are on Medicare and you feel might gain some value from this podcast. And secondly, give us a call, 844-607-SAVE. That's 844-607-7283 to schedule your appointment for the annual election period. We're doing this in a very organized fashion. We want to make sure we have enough time to answer everybody's questions and enough time to do all the homework on our end to make sure that we're finding you the right plan. You guys have been phenomenal so far about doing so. However, we are filling up quickly. We're about a little more than 2 weeks away from the annual election period at this point, right, Mr. Medicare?
It's about it. Time is going quickly. I need to let everybody know that as a licensed certified Medicare specialist, there are certain things that we cannot discuss on the show. Medicare has certain guidelines that we must follow. I will do my best to answer your questions on the air. However, if your question falls into an area that we cannot discuss on the air, we will call you and schedule a phone appointment so we can answer your questions. Now, tonight, we're going to have a little bit different show. We have a few guests that will be calling in and joining us. Matt had a good idea. He said, let's introduce some of the members of the Senior Health Desk team to the different audiences and all the different social media platforms you may be listening or watching this on. So what we're going to do is we're going to spend just a few minutes, 2-3 minutes, getting to know a little bit about some of the team members, because we want you to be comfortable when you call in and you schedule some time and you fill up that calendar. And this way, when they answer the phone, you'll say, oh, I know that voice. I heard them on the radio, or I watched them on YouTube, or whichever social media you're going to be using. Right. We just want them to be a a little more familiar.
Because here's the thing, and I appreciate all the feedback that we've gotten about this show and the education and help that we're providing folks. But there's a big, family of insurance agents that work with us, so we definitely can't take all the credit, and they got to have a little bit of their shine as well. So. Many of you have listened to the show, called or emailed with questions, visited our website and our YouTube page, and have scheduled an appointment for the annual election period starting October 15th. And for that, we just wanted to thank you. For this week's show, we're going to introduce the rest of the Senior Health Desk family. So like I said, we're a small team, and we do that on purpose. It's extremely important to us that we surround ourselves with like-minded individuals that all have the same goal and all share kind of the same morality, which is helping the Medicare community at large. So with that, I'm going to introduce our first, who is actually the Director of Client Services here at Senior Health Desk, Richard GIBSON. I think he's on the line.
Mr. Rich, are you with us?
Hey, Matt. Hey, Mr. Medicare. How's it going? It's Richard. How are you guys today?
Hey, Rich.
Not too bad. Rich, give me just a minute. There's something Matt's kicking me under the table I'm supposed to say. If you're just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also check us out on Facebook. Just search Senior Health Desks. Now, Rich, I'm told I'm supposed to kind of do a little interview thing with you, ask you a couple questions. Basically, we just want to get our listening audiences to be a little more familiar with members of the team. So the first question I'm going to ask is, where are you from?
All right. Well, thanks, Mr. Medicare. I'm originally from Jamaica, Queens, New York. When I was very young, we moved out to Long Beach, Lido Beach, Point Lookout area, which was a great childhood growing up on the beach. Freshman year in high school, my parents threw us in the car, and we moved to Atlanta, Georgia, actually about 40 miles north of Atlanta.
Little bit of culture shock there, huh?
Big-time culture shock. Came home from school the first day, and I was so happy. My mom said, what are you smiling about? And I said, they called me a Yankee. And I was so happy because Reggie Jackson, Mr. October, had hit 3 home runs in the World Series, and he was my hero. And my mom explained to me that's not the Yankees they were talking about. So that adventure began. Graduated high school, did a year exchange in Argentina, actually living in Argentina. And then I came back and moved to Columbia, South Carolina, got married, started a family, and was there for about 30 years. Moved down to Florida about 9 years ago. And now, like a wolf pack, my brother came down, his family, his kids.
That's great.
My children, once they finished school, came down. And now my mom also lives in an over 55 community in Delray. So we joke, like a pack of wolves, we always stick together.
I might have to sick you on my family. They're still in New York. I've been trying to convince them to come down here.
Palm trees and sunshine. We'll get them down here.
God willing.
All right. So, Rich, having now gotten a little better understanding of how you ended up being down here in South Florida, what brought you into the Medicare world, or how did you gravitate into this Medicare insurance world?
Well, I've always owned my own business almost my entire adult life. And when I had moved to Florida, I decided, I was going to just kind of take a job and get into sales instead of being the boss. I didn't want the keys to the building anymore. Too much of a headache after 30 years. I started investigating Medicare plans for my mom, actually, because when she was up in the Carolinas next to us, she had a Blue Cross Plan F, and they'd gone up to like $400 a month. It was something crazy. So when we got down to Florida, we realized a lot of this part of Florida anyway, southern parts, a lot of really good Advantage plans. So I started looking into it and didn't really get any answers. Of course, I made the mistake of answering the phone and responding to all the mail that comes in. So
right.
I did a bunch of research, and I finally said, to heck with it. I'm going to get my health license. And we kind of fumbled through it the first year she was on her Advantage plan here, but then I learned the industry, And I really like it. I like helping people. There's a lot of misinformation, but I'm good at helping people and kind of disseminate between the nonsense and everything. So it turned out to here we are now. A couple of years later, Mr. Medicare radio show, senior health desk, and we're helping tons of people, not just in Florida, but all over the country. So it feels really good.
Well, there are a lot of ways to help people on Medicare. Do you have any one favorite way, or what's the one thing you try and do for all of your Medicare clients to help them along their Medicare path?
The biggest thing is I get the most joy when I talk to someone who's been reluctant to make changes or, whatever the case may be, and then I'm able to convince them to allow me to at least look at the plans. Mm-hmm. And then it really feels good when I'm able to say, wow, I was able to save you money in your prescriptions or increase your benefits or just basically meet their needs because they've been sitting at home worrying about it. So that feels really good to be able to say, look, I saved you $50 a month, or we did this or that.
Sure.
So, and people are genuinely appreciative of that kind of thing.
No, that's great too, because I think it's human nature where people are afraid of change. Especially when it might be the first time that they're working with us, right? And I think that's I think that's really good. And the message that I want to send to our audiences, and that's why we're doing this radio show, is we will be the first ones to tell you not to change your plan, that you're on the very, very best plan. So, hopefully, those listening to you, Rich, and those watching on YouTube or iHeartRadio are getting a sense of the type of people that we are, so that you don't have to be scared about calling in. If you're on the best plan, we're going to tell you.
Last thing I'll say about that is that I can't tell you how many people I've spoken to. I've gone over all their options, A to Z, and given them so much information. And then they might have been 4 months, 6 months, or even a year out from taking their Medicare. And then all of a sudden I mail them a magnet so they have my number and they stick it on the fridge. And then 6-7 months later I get a phone call from them and say, all right, Richard, we're going with you because you're the only one of everybody I spoke to that told me every single thing and was honest. Everybody else was saying, had to do it by tomorrow, had to give me some money, whatever it was.
Right.
So I get a lot of people calling me back because I basically explain everything, maybe too much sometimes.
No, I don't think you explain too much. I've heard you on the phone. I know all of your Medicare clients appreciate that you take the time, that you explain things to them, you give them all their options, and you're not pressuring them to do something right away, because as you get older, making these decisions, and you only get to go on Medicare once. Well, unless you live a long time, if you go 65 and get another 65 years, maybe you can join again. But for most of us,
I'm not sure if that's how that works.
You can only join once. But if they have the confidence in someone such as yourself and the other agents that we're going to introduce in just a moment, I think they feel so much more comfortable, so much more at ease. And then when you follow up with them, keep helping them. I think that's a wonderful thing. So, Rich, thank you so much for doing what you do. I see next we have our next guest getting ready to join us. I'm just going to introduce her, and then Matt's going to jump in and give her some questions. Oh, Rich, I can't let you go yet.
Oh, he's gone. He's gone.
He's gone. Oh, he's gone.
We needed 2 truths and a lie from Rich, but that's okay.
That's all right. We'll get Trish on it. All right, so next, you all hear that wonderful voice on the phone is TRICIA. So, Matt, go ahead. Trisha's all yours.
Hey, Trisha. How's it going?
Hi, it's going great. Great to hear you guys. Y'all sound awesome. Thanks for having me.
Thank you. No, and thank you for breaking up your day. I know you have a busy day, and we're gearing up for AEP. And thank you for breaking off to be a part of the radio show.
Absolutely.
So, tell everybody where you're from.
Well, I am from South Texas, Corpus Christi on the Gulf Coast, if anyone's ever heard of it.
Awesome. Very cool. And so just to give you guys, a little bit of background about Tricia. So Tricia joined us earlier this year, and she's doing phenomenal. She's helped a tremendous amount of people. She's, we really see her as part of the family with us for the long term. What brought you to Medicare, Tricia?
Well, I mean, I've been in sales my whole life, and but I've always wanted to have that right, opening or industry where I can really help people. That's very important to me. And so, what better community to be involved in and help is the senior community. And I do take their health very seriously. So I think that, it's important to me that I can do something, like I said, that's worthwhile to be an advocate for them in their health and their livelihood.
Yeah, that's great, because you were, I think you were selling life insurance prior to this, right?
Mm-hmm. Yes, I was doing life insurance. I was doing final expense at the time, and but with my goal was really geared towards trying to get into the Medicare market. So it was all about the timing. So I'm very excited in regards to come on board with you guys. I've learned a lot, and I'm just looking forward to this AEP enrollment that's coming up here in a couple of weeks.
Awesome. No, we're happy to have you. And last but not least, so two truths and a lie for Mr. Medicare, because I can probably get this answer, but I want to put Mr. Medicare on the spot. So 2 truths and a lie.
Okay, so the 2 truths and a lie. So I was a fitness instructor in my 20s. I ran a marathon, and I was a hair model on the Tyra Banks show.
Okay. So
now I have to ascertain from those 3 which one is the lie.
Yes.
All right, so quickly run them through for me again.
Okay, I was a fitness instructor in my 20s. I ran a marathon, and I was a hair model on the Tyra Banks show.
I'll say you were not a fitness instructor in your 20s.
I was a fitness instructor.
Of course you were.
20s.
I knew that's what you were going to say. I was going to go with the second one about running the marathon.
That would be true. I have not yet ran a marathon.
See, I should have gone with my initial instinct. Everyone always says, go with your first initial instinct. Because I knew if she said the Tyra Banks show, that had to be true.
So you said you were a hair model on the Tyra Banks show?
Yes, For the they had like an Emmys episode, and so I got cast for that. So they were doing like the replicas of the Emmys from the night before. So, yep. When I lived in California, my ex-husband was in the Navy, so I was there 15 years.
Oh, that's great. So I wasn't aware that I was working with a celebrity. So when we get back to the office,
go that far.
Yeah, you might have to send me your autograph.
Okay.
Thank you, Tricia.
Thank you, guys.
All right, so we're going to keep going. We have 2 more guests that will be joining us momentarily. They're just trying to go through the process to get through here to the station so we can get them on the air. So what we're going to do while we're waiting for them is we're just going to go along these same lines. Matt, I've heard you on the phone. I know one of the things that motivates you is you want to help people and do the right thing, because I know you said your grandmother's 90. You just went up there and celebrated her birthday.
Yep, that's my
and
Mima.
You have family members, so I know that's important to you.
It is really important. And my whole thing with this industry is especially in the current or post-COVID days, the world is moving the way of technology as it is, where everything is being done over the internet, remotely. Everybody's working from home, so I found kind of doing things through technology a quicker and more efficient way of helping people. And COVID is kind of has pushed this to this point a lot faster. So what it is that we're trying to do is we're trying to bring the trust and care of a local agent that you would meet in your home over a cup of coffee or a cup of tea. We're trying to do that virtually for you, not only because it is more efficient, but because we're going through all of this COVID craziness. It's also a safer way of doing things. So I feel really, really strongly about that. So we're going out, and the thing is there's not many trusted sources out there for you to go to for help with your Medicare. So we're doing our best to put ourselves out there.
Very good. If you're just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also check us out on Facebook. Just search Senior Health Desk. Now, our next guest I see is queued up and waiting for us. So Matt is going to get involved now and have some questions. So we have Sue on the line. Sue, are you there?
Hello, Sue. Can you hear us?
Yes, hi. Can you hear me?
Yes, we can hear you now. Hi, Sue. How are you?
I'm doing good. Thank you for asking.
Good. So I mentioned you at the beginning of the show. You're the newest member to the family, and we're really excited to have you. And we really believe that you're going to be a strong addition to our little family here. So wanted to have you on just to tell the audience a little bit about who you are and kind of what drove you to this. So I'll start off. Where are you from?
I'm originally from England, a little town called London.
England. Who would have guessed?
A little town called London. A little town.
Very cool. And where are you living now?
I'm currently in Winter Springs, east side of Orlando, Florida.
Okay. In Disney World area.
Correct.
Very cool. Do you like it over there?
Yes. I see Minnie and Mickey Mouse. I see their fireworks. Can see through the window.
That's awesome. And what brought you to Medicare?
Well, I had my 215 life and health license back in 2018, and at that time I didn't have a clear mind what I wanted to do. Mm-hmm. And then my mother-in-law had passed away in 2019 due to her being diabetic. And I remember the time when she had questions for Medicare. I didn't understand it myself. So when I got the license, I wanted to target people that have diabetes because 1 in every, 3 Medicare beneficiaries, they have diabetes, and over 3.3 million Medicare beneficiaries use one or more common forms of insulin. So I think it's so important to, educate people about the diabetes, the insulin, and how we can help them in their coverage plan.
That's great. That's awesome. And for those of you listening on iHeartRadio or watching on our YouTube page, our Facebook page, you can tell that Sue really cares about what it is that we do here. She has a personal interest in it, with her mother, and that's why we added her to our team, because she fits in with what we're trying to do here. Thank you, Sue. And now the third question I have for you. So there are lots of ways to help people on Medicare, and I think you kind of answered this already, but what's your favorite way of helping people?
To have them understand, the diabetes itself and how we can help them through the Part D program. January of 2021, CMS, they designed a plan, part of Part D, called Senior Savings Model, and it actually helps people that can't afford the insulin. I think they narrowed it down to $35 a month, so I do want to strongly educate people how, if they are able to get that, and to get them in a better situation, because insulin is very expensive, right? It's more than a mortgage payment sometimes.
Absolutely, and Medicare has been doing a great job of trying to limit the cost of insulin, right? Like you said, and like when myself and Mr. Medicare first started, about 7 years ago, I don't know if you remember Mr. Medicare going over insulin and Humalog and Quick Pens. I mean, it was blowing the cost of the prescription drug costs out of the water. It was terrible. All right, so on a lighter note, 2 truths and a lie, Sue.
Okay, so here I go. Hope you can find out what the lie is and what the truth is.
Okay.
Okay, so the first thing is I've been vegetarian all my life, never tasted meat, poultry, seafood, anything like that.
Okay.
The other is I cannot swim for the life of me.
Okay. You said that with a lot of conviction. I feel like that one's true.
Well,
What's
wait a
the
minute. I
third
got
one?
one more.
Yeah.
And the third one is I love roller coaster rides.
Okay. Okay. Do you want to take this, Mr. Medicare, or do you want me to?
No, I bombed on the first one. I should have gone with my first instinct, and I didn't.
I'm going to say that you hate roller coasters, and the third one is a lie.
The third one was the roller coaster. You mean the second one?
The lie. The lie was the third one.
He thinks the lie is that you love roller coasters.
Yes, that's a lie.
Got it. I still got it, Sue. I still got it.
Yeah, he's very happy. He guessed right. I guessed wrong. So Matt's happy.
And a little side story. So my mom is I guess she's a pescatarian. So she eats fish, but she doesn't eat meat or anything like that. When she was, I don't know, probably 14, 15 years old, my grandfather, her father, said, hey, I'll give you $20 if you eat this hot dog. And back then, $20 was a good bit of money. She refused to do it.
A woman of conviction.
Same thing with me. I just love being vegetarian, and I've always, kept it up and being healthy and doing everything outdoors. I just love that. Love the nature.
Absolutely.
Well, thank you for joining us and telling us a little about yourself. If you're just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also check us out on Facebook. Just search Senior Health Desk. Now I see we have another guest. We don't have a lot of time left, but we're going to give Jason time. So, Jason, welcome to the show.
Hi, thanks for having me.
So, Jason, we're going to ask you the same questions we asked our other guests, so we're being fair to everybody. So just so our audience can get to know you a little bit, where are you from, Jason?
Sure. Well, I'm actually from born and raised in the Great Lakes State, or, as some people may say, the Mitten State of the Midwest, Michigan. I'm a proud Michigander.
A Michigander. That's what they call people from Michigan. Michiganders.
That's true.
Very good. So what brought you to the Medicare world?
Well, it was actually in 1995. I chose the Medicare profession after my grandmother had a lot of issues finding the accurate information. Mm-hmm. And she actually enrolled into the wrong plan and was overpaying the insurance company for her coverage that she could have gotten for less.
Sure.
And it's then I realized on a fixed income that it's hard to do.
Right.
Very good. Well, that's the way a lot of us got into that. We had a family member or a good family friend that went on Medicare, and then we realized they really weren't on the best plan. But that's an excellent motivator to get you, because we can all hear in your voice that you want to help everybody who's on Medicare. Do you have any one particular way that you try and help people?
Well, I suppose right now it's been, I really enjoy sharing my Medicare knowledge with the beneficiaries because I like to make sure they're in the correct plan and not overpaying for their benefits.
Right.
You know, as you know, as a nationally licensed agent, we devote a lot of extensive amount of time to study and testing, and so to meet the federal regulations. So I really take great pride in being able to share my knowledge.
And just a side note,
it's a confusing subject.
Yeah, and just a side note, I know we're running short on time here, but I want to add that, you know, Jason mentioned that he's been doing this since 1995. He is an expert in insurance. So feel free to give a call in. You can ask for Jason, Sue, Tricia, Rich. If you heard somebody that you liked, give a call in.
Well, Jason, thank you for calling in and letting us get to know you a little bit better. I'm going to use the last couple minutes just to wrap up, let everybody know we help people all over the United States. Tell all of your family and friends to join us every Thursday at 7 p.m. Eastern Standard Time. Our goal is to help as many people as we possibly can. If you have a question but you don't want to call in, call the Senior Health Desk at 844-607-7283. If we are on the phone, please leave a detailed message. And to give you a heads up for next week's show, we're going to be talking about Medicare horror stories. And
Just
I know,
in time for Halloween.
And I know Matt, Rich, all the agents have plenty of those, but we'll get to those our next show.
All right, so our goal is to educate and inform you about Medicare. We want you to enjoy your life. We don't want you to have to worry if you have the best coverage at the best price. Let us worry about that. We don't charge anything for our services, and we'll take care of all of that for you.
We do really want to help as many people as we can. So please call 844-607-7283. Say you listen to the Mr. Medicare show. If you have a question, we will definitely get back to you, and we will help you in any way we can. Our goal is to help as many people as we can, so please share this information with family and friends so they can join us every Thursday. Our goal is to help people. I know that's Matt's goal, Rich, Trish, Sue, Jason, all of us here at the Senior Health Desk want to help as many people as we can.
And if I can just add, I know we're running short on time, but if you've liked what you've heard tonight from our family here of Medicare agents, please subscribe to the YouTube channel. We do a show every week, and we try to inform, we try to do our best to educate and inform the Medicare community at large.
That is true. So join us next Thursday. We'll talk about Medicare horror stories. Thank you for spending this time with us. We'll talk again next Thursday. See you then. Bye-bye.